We see every day 50 to 60 patients who come to our emergency department with pneumonia, and most of them are so severe they need very high FiO2 of oxygen. And so we have to reorganize our emergency room and our hospital in 3 levels of intensity.
It's been like a war zone, a medical war zone. So before I start my shift, I have to pray and meditate for at least 5 minutes to get my mind in the setting of going into this war.
As hospitals are flooded with more critically ill patients than they have the resources to treat, they've had to start prioritising who's given the chance to live and who isn't. It's an old wartime practice known as triage, but now it's come to life in peacetime. It's the process of sorting patients according to a system of priorities in order to save the greatest number of people possible. It can often determine who lives or dies. And in Italy, the biggest crisis since World War II has in some cases already forced doctors to decide which COVID-19 patients will have access to a ventilator and which ones won't. So who gets priority? Triage systems can vary from hospital to hospital, but priority is normally given to those most likely to be saved and most likely to live longer. Shortages in protective gear is promoting a discussion among health professionals about do not resuscitate or DNR orders. A DNR tells healthcare professionals not to perform CPR if a patient stops breathing or their heart stops beating, as CPR, a hands-on response in the absence of ventilators, would expose doctors and nurses to COVID-19 infection, especially if they aren't protected properly.
People talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion.
But a month after Dr. Birx made that statement, New York officials did in fact issue a blanket DNR order. The Regional Emergency Medical Services Council instructed first responders not to transport cardiac arrest patients who cannot be revived at the scene to the city's strained hospitals. The move sparked outrage from the city's healthcare professionals. Officials retracted the order just a few hours after New York Post first reported it. Even before the DNR order surfaced, there were reports that some US hospitals had been circulating triage guidelines, so that doctors are not left to make tragic choices that may leave them burdened with guilt. Louis Kaplan, the president of the Society of Critical Care Medicine and a surgeon at the University of Pennsylvania, told the Washington Post,
"We are now on crisis footing. What you take as first come, first served, no holds barred, everything that is available should be applied medicine is not where we are. We are now facing some difficult choices in how we apply medical resources, including staff."
And these are the scenes and discussions in the US and Italy, both countries that have quality healthcare facilities relative to the rest of the world. As COVID-19 outbreaks occur elsewhere and expand into the developing world, how often and to what extent will we see triage